Robert F. Kennedy Jr. takes the reins of the Department of Health and Human Services, and there are several growing health concerns across the country. In Texas and New Mexico, an outbreak of measles has infected nearly 100 people so far. There's also the escalating bird flu outbreak. The Trump administration fired some employees who were working on that and are now trying to rehire those staffers. And the CDC's popular and effective ad campaign on the flu vaccine has been halted in the middle of peak flu season. Joining us now, NBC News medical contributor Dr. Vin Gupta and physician and senior public health contributor for Forbes, Dr. Omer Awan. Thank you, both of you, for showing up. And Dr. Gupta, we also want to speak with you both about the Pope's health and prognosis. But first, these changes that are happening within our health system, what are your biggest concerns moving forward? Dr. Gupta.
Well, Mika, good morning. Let's start with what's happening in Texas. I think that's something that's extremely serious for your viewers. Just to have context on, about 1 in 5 people, if they're not protected and vaccinated, have serious consequences. Mika, can end up in the hospital. So this is not just, let's manage this at home. This has very serious impacts for people, and especially in kids, their ability to have a normal childhood and to progress and have a healthy lifespan. Most of the cases here are in unvaccinated children. And the question I get often is, what should you do if you are living in this situation or if you're exposed? And so a few things that you can do. If you're watching this right now, please pass on the word. But if you were born before 1957, you have a known 2-dose vaccine history, you've had known prior measles, or critically, if you've had titers confirming immunity to measles, you don't need to necessarily speak to your medical provider about a measles shot. If none of those apply to you, please speak to your medical provider. And I've been counseling patients across the spectrum. Go get titers for your measles vaccine.
So, Dr. Wan, you've written about the CDC halting what you deem a successful flu vaccination campaign. Tell us why they're doing it and why it alarms you so much.
Well, I don't know why they're doing it, but it's very alarming because this flu vaccination campaign is critically important to educate the public on why vaccination is so necessary. And the reason why it's so critical is because, this vaccination campaign teaches and educates the public on why vaccination is critical, particularly, being able to transform a very serious disease into something that's very mild. And when you take that away from the public doesn't have access to these critical websites, these ways to protect themselves and their families. So it's very alarming that we're taking that away, and it comes at a time when flu is surging. When we're talking about 29 million people that have had the flu this season, we're talking about 16,000 people that have already died. This comes at an extremely inopportune time, unfortunately.
Yeah, flu and COVID, of course, right now running rampant. We also, Robert F. Kennedy Jr., the head of HHS, has been a real vaccine skeptic. And we also know that the federal government now, with Kennedy in position, has been really cutting back on funding for health research. And we've been talking about that these last few days. It feels like, of all of the headlines that are coming out of Washington right now, this is one of the most worrisome to so many people. Talk to us about what it's been like in your field, your community, and what your concerns are.
Well, it's concerning because we're scared and we don't know. And, hospitals are talking about this. We don't know if we're able to fund, a certain important research personnel. We're talking about getting rid of people that have developed life-saving vaccines. We're talking about firing people that are making drug discoveries that are potential cures for cancer, for chronic medical diseases. We're talking about firing and letting go of people that have helped contain important outbreaks like measles, COVID, Ebola, even in Africa. So we're not safer by getting rid of these people. These people have safeguarded health for you and I. And this is why this is so concerning and deeply troubling for so many.